This conference will now be recorded.
Okay, everybody, well, welcome to the Alliance's weekly webinar. We are very happy to have you here on November 12th, 2020, as we are rapidly, I guess, sliding into the holiday season. I hope all of you are finding ways to connect with family and friends in this very strange time. But we look forward to continuing to work with you in the remainder of 2020 that we have left. We'll obviously be skipping some weeks here and there for the holidays, so we will enjoy our camaraderie in the time that we have. We have some wonderful presenters today. We have Miss Rochelle Thompson, who's with the American Lung Association, and Aleshia Jones, who's with the Mississippi Tobacco Free Coalition of Harrison County. So we look forward to hearing from them in just a few minutes. But as we do every week, we do want to take a moment and acknowledge the lives that have been lost due to COVID and social injustice. When it comes to COVID, folks, the numbers across the nation are looking real scary. I think they said that yesterday was our highest day as a nation, 140,000 cases. And even places in Mississippi that wouldn't necessarily have a mask mandate do have a mask mandate. So check your local areas, because it's real everywhere. It doesn't matter who you are or where you may be living. So please take care of yourselves. And on that note, before we take our moment of silence, I do want to highlight that there's a wonderful resource that the Hub Network has been sharing, the volunteer nonprofit Hub Network, of a video of how to apply for CARES Act dollars. There is a lot of money out there that can really help your organizations. So please take advantage of the resources that are out there. The community foundations are working incredibly hard to try and get out thousands and thousands and collectively millions of dollars to nonprofits and organizations just like yours. So please reach out if you need assistance, reach out if you have questions, look at the videos. I'm not kidding. They are trying to get those dollars out and spent. So don't waste time and think that it doesn't apply to you. Take advantage. So with that, we will take our moment of silence and acknowledge the loss of lives. If you'll join me now. May they rest in peace. Okay. So on to some better news and happiness to brighten our day. We're going to start off with Miss Rochelle Thompson. Rochelle is employed by the American Lung Association, as I said, as a senior manager. The Lung Association is often considered as a leader in the state for educating the community on lung disease, offering tobacco cessation services, and advocating smoke-free policies. Rochelle's duties include managing operations and grants for the Mississippi and Arkansas offices. Over the past 25 years, Rochelle has managed various grants focusing on drug prevention and prevention services. Rochelle is a passionate public health advocate. She played an instrumental role in the passing of 11 comprehensive smoke-free ordinances in Madison, Yazoo, and Holmes counties, in addition to the Madison County Smoke-Free Ordinance. Thank you, Rochelle, for that. Her diverse networking skills show her to work throughout the state, reaching communities in urban and rural areas. Schools, health advocates, faith-based, and civic organizations often seek out Rochelle to conduct various trainings, facilitate workshops, and to coordinate conferences and awareness events. Rochelle has received numerous awards as a business leader and for her community service efforts. She is devoted to her spiritual life and her church family. She is a member of St. James Deliverance Ministries in Durant, Mississippi, and attends Priestley Chapel Church in Canton, Mississippi. She was born and raised in Holmes County. Rochelle resides in rural Madison with her husband, Montel. And as we were just discussing and cajoling before we met today with all of you, previous resident of the Landmark building, which is where the Alliance is housed. So lots of fun memories. And Rochelle can tell me where all the best spots to hide things or find things are as we get more people into this developing building. So with that, Rochelle, thank you for taking the time to be here today, and the floor is yours.
Thank you, Dave, and thank you to the Mississippi Alliance for Nonprofits for having me on today. And you actually said that they gutted the place. So, you know, all of those really neat places, hiding places that I knew, I feel like they have been gutted. And so I don't want to leave you down the wrong path. So, but we will talk about the that building again at another time. Just again, like I said, thank you for allowing us to be on the call this morning. I've been very excited about speaking to you all on today. And just want to let you know the American Lung Association is a leading organization working to save lives by improving lung health and preventing lung disease through research, education, and advocacy. Our work is focused on 4 strategic imperatives, and that is to defeat lung cancer, champion clean air for all, improve the quality of life for those with lung disease and their families, and create a tobacco-free future. This morning, I want to talk to you all a little about Lung Cancer Awareness Month. November is Lung Cancer Awareness Month. Next slide, please. The American Lung Association is putting out its 3rd annual State of Lung Cancer report. It has been embargoed to November the 17th, but don't worry. I am going to send this report to Dave when it is published and ask him to send it out to all of the Mississippi Alliance for Nonprofits email distribution list. So all of those organizations that are with the Alliance. Some of the things that the report will list is it will compare the states on new cases of lung cancer, survival rates, early diagnosis, surgical treatments, lack of treatments, and screening. The overall message from the reports is the states must do more to protect residents from lung cancer. And we really believe in that, and that is part of our awareness and education campaign with the American Lung Association. Also, too, the American Lung Association is a leading organization on COVID-19 and lung health. You can find all of that information on our website, lung.org. We also have a series of town hall meetings on the website. Actually, Dr. Fauci was recently focused on one of our town hall meetings, and a lot of very interesting information came out from that town hall meeting. Again, the report will have Mississippi rates and the areas where Mississippi need to target. I have had a chance to review the report. It is an internal document right now. And in Mississippi, one of the things that we need to work on is early diagnosis. So encouraging individuals that have symptoms to get a lung cancer screening. So that is where our focus would be for the next year here in Mississippi, is putting efforts in encouraging individuals to get lung cancer screening so that we can get those early diagnosis, start those treatments so that the cases will have a better survival rate in Mississippi. That is all that I have for you all on today. Next slide, please. Our vision at the Lung Association is a world free of lung disease. If you have any questions at all, you can reach me at the American Lung Association, Rochelle.Thompson at lung.org. That lung cancer report will come out. Along with that, my contact information will be listed. The American Lung Association also is the fiscal agent for several Mississippi tobacco-free coalitions in Mississippi that are located on the coast. And at this time, I have the pleasure of presenting to you all Aleshia Jones, which is the project director for the Mississippi Tobacco-Free Coalition of Harrison County. Aleshia, take it away.
Good morning, everyone. Sorry about that. Dave, did you want to do my bio first, or did you want me to just go ahead and get into it?
No, I would love to. I would love to. Rochelle just set it up so perfectly. Thank you, Rochelle.
She's the bomb. I'm telling you, I have the best supervisor ever.
That was perfect. Okay, everybody. Aleshia Jones is the project director for the Mississippi Tobacco Free Coalition of Harrison County, serving under the direction of American Lung Association. Aleshia attended the University of Southern Mississippi from 2005 to 2007, where she received her BSBA with an emphasis in accounting. She later received her MBA from the William Carey University in Gulfport in 2009. She started in this role back in October 2018, but has spent the last 10 years of her life working in public health for the Mississippi Department of Health in various roles, but all having one goal: to eliminate low breastfeeding rates and infant mortality among the lower 6 coastal counties. She also acquired her certificate as a certified lactation counselor in 2016 while working as the regional breastfeeding coordinator for MSDH, and she is a certified child passenger safety technician as well. She successfully runs a coalition with roughly 25 members. Aleshia works alongside the community to share education and awareness throughout Harrison County to combat this e-cigarette epidemic known as vaping. They are currently working in Harrison County to hopefully establish smoke-free ordinances and other policies to regulate clean air. A friend once said, "A problem isn't a problem until the problem is yours." So she lives out her days trying to combat these problems before they reach your doorsteps. Aleshia, thank you very much for taking the time to be here today, and the floor is yours.
Thank you, Dave. Well done. As he's already stated, my name is Aleshia Jones, and I do run the Tobacco Coalition in Harrison County. As Rochelle already alluded to, there are currently 3 project directors on the Gulf Coast, actually 4, but 3 of them are underneath the jurisdiction of the American Lung Association. So if any of you are in Jackson County, your project director will be Kaylee Shorter, and if you are in Hancock or Pearl River, your project director would be Brittany Johnson. But don't fret, there are 34 of us in the state. So there is someone to cover every county in the state of Mississippi. And if you need to know who your project director is, please feel free to reach out to me and I will give you that information. And I'll go ahead and give you my email quickly. It's aleshia.jones, the way you see my name spelled on the screen, @long.org as well. So I'm going to just give you a little summary of what we do as project directors. So yes, we do run a coalition, and so that will be a volunteer position for anyone who decides to join the coalition. It is open to anyone. People who are smokers, people who are former smokers, retirees, youth. We definitely want to have that youth component because that is so important, especially when dealing with the vaping aspect of the coalition. Other nonprofits, businesses, faith-based, anyone who wants to be a part, we are here, especially if trying to eliminate smoking and vaping is near and dear to your heart. I feel like the overall mission of the coalition is to basically eradicate smoking, vaping, anything that pollutes our air. We really want everybody to breathe easy. And so we offer different presentations for youth groups, for what can I say, nonprofits, faith-based, anyone who needs presentations, we can do a presentation. And I actually compiled some slides to show you kind of what presentations that we do. So I'll get into that, and then I'll jump back into the coalition. So this slide right here came from my secondhand smoke presentation. So in case you didn't know, secondhand smoke is a combination of smoke from the burning end of a cigarette and the smoke breathed out by smokers. Secondhand smoke contains more than 7,000 chemicals. So in case people don't know, there are currently 7,000 chemicals in cigarettes. Used to be 4,000, but they keep adding to it to keep people addicted. So we can do a secondhand smoke presentation for anyone daycares who want to give further education to their staff so that they can help parents when they come, because what people don't think about, when you smoke in the car, secondhand smoke, it lingers for 4 hours. Then it settles and becomes third hand smoke. I've done a lot of presentations to children, and they seem to think that it dissipates, that it's no longer there. And so I feel like if kids think that, adults might think that as well. So this slide comes from a presentation that I do, and it's called The Evolution of Smoking, Pregnancy, and Breastfeeding. So as you can see, it says a mother can be, I can't really see my whole screen right now. I'm sorry. I don't know how to reduce it. But you can read what it says. But mother can be her baby's worst enemy, basically. Unfortunately, I actually know someone who smoked during her pregnancy, and it caused her to have a low birth weight baby. So we want to get that education out there and assist these moms when they find out they're pregnant to, if not quit, at least reduce how much cigarette smoke they're taking in. I know that might sound bad, but even the less you smoke, you do have a better chance. And, we want to let them know we are a resource. We actually provide to the community something called a Freedom from Smoking Clinic. It is a 8-week course, and we basically teach people how to become quit. And that is something that we're still offering again this year. It will be virtual, but it will be something that is offered this year. So if you need that information, please let me know. This is another slide that came from one of our presentations, which is called The Health Effects of Tobacco and Vaping. So the benefits of quitting: within 48 hours, your nerve endings start to regrow. Your ability to smell and taste is enhanced. Your bronchial tubes relax, making it easier to breathe. Lung capacity increases, making it easier to do physical activities. And in 2 weeks, your circulation improves and your walking becomes easier. And I have more stats as well. But it really hurts my feelings sometimes when I hear people say, well, I've been smoking for so long, I'm too old to quit. It's never too late to quit. Because as you can see, there are benefits that happen within the first 48 hours. And just to let you know, I love that show. But anyway, moving on. So, but there are many benefits that can help someone within the first 48 hours. I've done several events and health fairs on the coast, and I love when people share their stories with me. And one lady shared with me, I was at one of the casinos, that her vision improved. Once she became quit, her vision improved. And the only way I can think of it is you have to think about it. Oxygen flows through our veins. So because she's not smoking anymore, those toxins are no longer in her blood. So she has better oxygen levels going to her eyes. That's the way I see it. And people don't sometimes think about that. It affects your overall health, everything. It all works together. So then this one comes from Smoking and COVID-19 presentation that we have. So tobacco smokers may be more vulnerable to contact COVID-19. The body's ability to fight off infection is lower, easily becomes sick and takes longer to heal, and has a higher risk of developing severe outcomes and death. So we already know your lungs are already not the best because you chose to smoke. And some people smoke 2 packs, 3 packs, or have been smoking for many, many years. So this definitely makes you predisposed to get certain conditions like asthma, emphysema, COPD, and now COVID. So with that being said, unfortunately, sometimes smokers may die from it. And if they don't die, they may have conditions that exist after the COVID symptoms are gone. So we want to also get this information out there as well. And then we have another presentation that is educating people on nicotine salt. So it says nicotine salt is the new thing on the block, and smokers are flocking to it. Nicotine salt is a natural state that nicotine is found in. Nicotine salt allows people to vape at higher nicotine strengths, getting the rough throat hit. Believe it or not, there's something called the throat hit, and people like it. There are 2 types of nicotine salt out on the market. You have your salt-based nicotine and then your free-based nicotine. So this is a presentation we can do well that actually talks about nicotine salt and products and the different vapes. Unfortunately, vaping is an epidemic among our youth and our young adults. So they think it's just nothing. they don't realize their bodies are still growing. The human brain doesn't fully develop until you're about 26, 27. So now you're adding all these harmful chemicals into your body, and it can somehow, it can maybe can stunt your growth. And now you're having these symptoms earlier. You know, one thing kids do not realize, which it baffles me, is that when you smoke or you vape, it raises your heart rate. Do you want to be 18 and you have high blood pressure? They're not thinking about that. So like I said, we want to get this education out to any and everyone who would like us to share it with them. And then this is just one I made up and put in there for one of my presentations, just talking about keeping your mask clean, because that was the one thing that bothered me when we had to start wearing these masks. People were wearing them around their neck. They're not washing their hands, sanitizing their hands. They're doing all kind of things with them. And I actually asked people, like, do you wash your mask? They're like, no, I haven't washed it. And here we are 3 months into COVID. So I just made this little slide to remind people to wash your mask. Don't wear them around your neck. Don't immediately pull them off your face. Sanitize your hands first and keep them in a secure location. So like I said, that's just one I threw in there. But this is the kind of thing that we do as a coalition. We go out and get the information out. I'm not the only one who can present. Anyone in the coalition who feels comfortable in presenting this information can present it. We have a scope of work that we do is given to us each year by the Office of Tobacco Control. It has been a little more taxing this year to try to get it done, because since I am under jurisdiction of the American Lung Association and my other two counterparts, we have been mandated to work from home, so we can't do face-to-face. Right now, the date is January the 2nd. We may be able to go back to our offices, but right now we're working from home. If you're in a different location, you might have a different project director who is doing face-to-face events and meetings. So it could be different. But we have incentives we like to give out. Sometimes we do presentation. We provide snacks or meals. It just depends on what our budget is looking like. So please utilize us as a resource in your community. Like I said, we have different things that we do in our scope of work. One thing that we do within the schools, we try to send out a PSA to make sure that when people come to events, that are on school property, they know that there's supposed to be no smoking, no dipping, no tobacco, no nothing there. Those schools are paid for with federal money, and all of that is not permitted at the school. We also do what else? Oh, tobacco announcements. This year we've been sending out tobacco announcements to the school, because you know how they do announcements at the school. We're hoping that they will read those announcements just to give a fact about tobacco and keep it on the forefront of everybody's mind. The thing that I don't know, and the stats may not come out for years, is since we've been in our houses, since we've been in the pandemic, the kids were out of school for like 5 months. Did vaping increase? Or did it go down? Because now you're at home. I don't know if everybody's parent was working from home, but were they able to access it more or access it less? So this is things that we think about in our job. So like I said, we are a resource. We have pamphlet, brochures, we have posters, anything you may need to set up a space where people will know that this is a smoke-free environment. We can also work with businesses as well with their smoking policies. If they need information when it goes to helping their employees become quit, whatever you can think of, we are here. And we just want to get the information out there that we are here to be a resource. And of course, all of this is free to the community. We just need to know that you need assistance, and we are available. So I hope that something I said was beneficial to you and your organization. And that's pretty much all I have. Any questions? I'm ready.
All right, perfect. Thank you. Let's see here. Sammy has a question. Do you do public policy work? And if so, what are the policy issues you're working on?
The main policy work that we try to do is to set up ordinances within our cities. And it's going to go by county, and not just partial ordinances. We want to do comprehensive ordinance, because then that covers the city about ends, which is the electronic devices, electronic nicotine devices. That's what N stands for. So that's where we stand. We really want to make sure that a city has a policy in place, because, but let me say this, as you know, I have Harrison County, right? And if you don't know anything about Harrison County, please know I have casinos. So that makes it a little more difficult. Last year I worked with Long Beach. This year was trying to work with Pass Christian before the pandemic started. So I'm trying to work with them again. But like I said, having to work from home has kind of posed a little difficulty. And I'm not really sure if they have went back to face-to-face meetings. But even if they have, I'm not permitted to go to them right now. So some challenges, but we're still not giving up. I'm praying maybe at the beginning of next year, we'll be able to get back out in the community and I can hit the ground running with really trying to focus on reducing the smoke, the toxins and everything in the air by getting more ordinance in place. Also, too, since he brought that up, we do offer grants to the cities as well. There is an RFP that the city can sign up for to help them work on their ordinance. And then Blue Cross Blue Shield offers a grant too once they become the ordinances in place. I know Moss Point, if I'm not mistaken, was a recipient of it, and it may be some other cities along the coast that was. Out of the Jackson County, Pearl River, Hancock, and Harrison, I'm the only one with no smoke-free ordinances yet. Gulfport does have a partial ordinance, but it does still allow for the smoking in the bars and the casinos. But I mean, we're grateful for that, but we would prefer to have a comprehensive ordinance. And I hope that answers your question, Mr. Sammy.
Also, excuse me, Aleshia, I just want to add
Go
that
ahead.
that the Mississippi Department of Health actually has a coalition, the Tobacco Control Network. And with that network, they have some partners that work at the state level. And each year, there is legislation that goes forth for a statewide ordinance. The Mississippi Tobacco Free Coalitions work at the local level. However, we have a group of partners that are boots on the ground, running at the Capitol, trying to get a statewide ordinance. Of course, you know that it is challenging working at the state level, but we are those partners are working hard each year. And like I said, every year there is a legislation that goes forward. They just had a meeting last week and I wasn't on the call, so I don't have the bill for this year, but I can get that information if needed.
I'm curious, I remember growing up in Los Angeles, and one of the big issues that we had as they were working on this policy was the beaches and people, seeing it as an open space. And so unlike a university or an indoor area, that there was sort of a real pushback about that specific element. Do you find that it is pushback just broadly on the coast for all of the sort of normal reasons, or is there a conversation around what's happening with the beaches as well?
I personally feel like it's a pushback just overall. I even talked to one gentleman and he didn't really understand what a smoke-free ordinance would entail. He basically said, if they try to tell me that I can't smoke at my house, they can't do that. I said, no, that's not what it is for. I said, to protect people when they're in public places, especially our children. I mean, I would love, because I have researched it more, and there are, I think, 13 states that have this in place where you cannot smoke in the car with your children. I don't understand how that's allowed. You're not giving them a fair chance, and they can advocate for themselves, but they are not adults. They don't have the final say so. I do feel like sometimes parents are a little more cautious if the child has a condition already like asthma, but it should go for all children. And I even commend parents. I've sometimes seen parents standing outside their car smoking before they get into the car. And I even just applaud them for doing that, even though it's still going to settle on them. At least they didn't smoke in the car with the baby. You have to meet people where they are. But that's why education and awareness is so important. I love doing fairs. I love talking to people and just giving them that information. And, it's so funny. As soon as people see my tablecloth and they know they smoke, they'll sometimes run past me. And I always tell them, this is a judgment-free zone. We all have our vices, and I don't mind sharing mine. I love to eat and I love to shop. Some days I win on them, some days I don't. But so I'm not here to judge you. I'm just here to educate you and to help you make an informed decision. They like, I really need to quit smoking, but I'm just not ready today. Well, at least you know where you are. Like I said, I just want you to know you do have a resource for when you are ready.
Are there percentages or statistics around usage? So do you find that in Mississippi, the number of active smokers or vapors is very high with youth and adults or elderly? Do you find more traditional cigarettes higher with the elderly? Sort of what kind of perception should we have of our Mississippi citizenry?
Well, I will start, and Rochelle, please fill in where I might have missed off. Well, we know that vaping is truly a young person's thing. Not saying older people don't vape, because there are literature out there, there is stats out there that says that if you are a smoker, already been a smoker, smoking cigarettes, someone older, not a teen, but if you are already a smoker, there are information out there that says that going to a vape is better for you than using the cigarette. So there are older people who do vape. Many of them believe that when they vape, it has absolutely no nicotine in it, because the e-juice that you put in vapes, the ones that are not pre-filled, sometimes you can find e-juice that says 0 nicotine. I didn't mix it. I don't know if it has 0 nicotine in there. And this is what I always tell people. I try to eat sugar free, but guess what? I know there's still some sugar in there, because the sweetness came from somewhere. So that's what I try to explain to them. But they want to argue and say, no, it's 0. So, but I try to educate them on it. When it comes to cigarettes, the youth are not smoking cigarettes like that. Their thing is truly vaping and juuling. It became so popular, it was coined the phrase juuling, from the name Juul of a popular e-cigarette that the youth pretty much like. Since then, there's so many copycats out there. And that's what the kids don't understand. The pods were not supposed to be refillable. And let me explain to you about a pod. A pod has 59 milliliters of nicotine in it, which is equivalent to a pack of cigarettes. A pack of cigarettes holds 20 cigarettes. Some kids can go through 2 to 3 pods a day. That means they're pretty much like 2 to 3 pack day smokers, if you understand what I'm saying. That's the equivalent. So that is their thing. Then they made them cheaper, because when they first came out, they were like probably $50, and then the refills were 15 to 20. Now you can get a disposable one for 99¢, I have been told. I did a presentation at MGCCC last November. We have the Great American Smokeout every November. With that being said, I was so excited. I had gum and candy, trying to get them to switch out their vape for gum and candy, something just to stimulate their mouth. A young lady actually gave me her vape. I was so excited. And then she pretty much burst my bubble by saying, it's okay. I work at the mall, and it's disposable anyway, so I can just buy another one. But she said, but then she tried to make me feel better. Say, at least you'll keep me from smoking for the next 2 hours. So I'm just letting you know, when things are cheap, just like with fast food, that's what you gravitate toward. So that's where we are. Cigarettes, for most people, older people, that's where they are. They still want that cigarette, not a vape. Because and that for whatever reason, because they've heard how bad vaping is and the way kids were dying and getting sick from it, they are quick to tell you, oh yeah, I smoke cigarettes, but at least I don't vape. So there's all this misinformation out there. Cigarette smokers think vaping is worse. Vapors think cigarettes are worse. So it's just all this misinformation out there. And we truly have our work cut out for still educating and re-educating.
Dave, I also want to add.
No, go ahead, Carla.
I think Rochelle wanted to add that, but I have a question after.
Okay. I also want to add that adult smoking is above the national rate here in Mississippi, and then youth vaping is above the national rate at all. One thing that we have noticed, that youth that start to vape in 2 to 3 years will start to smoke cigarettes, and these are not the traditional youth that would have actually started smoking, that maybe had parents smoked, was influenced by someone else that smoked. They actually start vaping, and then they move to smoking. Also, too, we're seeing that adults, when vaping first came out, they were trying to promote it as a cessation tool, and a lot of adults got sucked into that. And so what they actually, research shows that a lot of adults that start using vaping as a cessation tool are now dual users. But here in Mississippi, we do have research and that you can go out and look at what's going on in Mississippi, not just from smoking, but from nicotine use. That means smoking and smokeless tobacco. And that is MississippiTobaccoData.org. You can go out there and find information on smoking and smokeless tobacco use and nicotine use. Also, too, you can find by county you can go out and look under the county rankings, and that is a website by the Robert Johnson Foundation. And then too, there's a campaign for tobacco free kids. We'll have Mississippi specifics out there as well.
Are you all currently partnering with Jill Gordon of Enrich, Mississippi? She's a member of the Alliance, and her mission is to educate and eradicate vaping amongst youth. Right now, she's recording videos for her virtual vaping summit that's coming up, and she has funding with the Mississippi State Department of Health and has a youth program here in Central Mississippi. Have you all done any partnerships with her? I think she has a good hold right now on getting the youth involved.
Carla, I personally do not. I have met Jill when they had the virtual, not virtual, I'm sorry, when they had the vaping summit this past February. I was there, and so I got to meet her then, and I actually was on the call when Jill spoke about the virtual vaping summit that was coming up. She may be utilizing the project director that's in that county, which I'm not sure she was doing it out of Madison or Hines. I can't remember, but she may. I'm sorry.
She works, I think she's based in Rankin County.
Rankin, okay. Well, she may be using that project director, but as far as locally on the coast, I have not collaborated with her yet, but I'm definitely open to it. Whatever, because I know we're all trying to do the same thing, and sometimes two heads are better than one, so I love to collaborate with people.
Carla, the way the Mississippi the Office of Tobacco Control is set up is the Mississippi Office of Tobacco Control has tobacco-free coalitions, and they also have statewide partners. And that is what Jill is. She's one of those statewide partners, and her task has been to combat vaping in Mississippi. I think if I'm not mistaken, she just became a statewide partner last year. She is doing a lot of work, and they are looking at bringing the Mississippi Tobacco Free Coalitions, partnering them with Jill to be able to carry her message throughout Mississippi. So, in other words, the work that she's doing is somewhat new, and some of the Mississippi Tobacco Free Coalitions have been able to sit in on some calls and some summits that she have done, but the way that her organization is set up is to pull them in for future engagement.
And I saw that Sammy Moon had a question. He said there was a class action lawsuit against cigarette makers that ended up with a huge amount of tobacco money being distributed to the states. Is there any movement toward a class action lawsuit on vaping? Since the same principles apply, the manufacturers know that know what they're doing, and they know they're doing harm. That is true. They do know they're doing harm. I don't know about if there's a state one. I know there are different lawyers throughout the state of Mississippi who have a class action suit for vape, and I know there's actually one on the coast as well.
Great. And there's a question from Tammy here. Is there any movement toward national legislation against vaping, similar to the FDA banning of clove cigarettes years ago? It seems vape pods come in enough flavors to be in that same category as cloves.
Rochelle, do you have an answer to that? Because I'm not aware, and I do apologize.
Yeah. Tammy, as far as I know, the last information is that the FDA did put some banning on flavored vaping. However, the tobacco industry owns most of the vaping companies, and so they have various ways of getting around FDA legislation and banning. So you may have a vape that was called strawberry daiquiri, And so sometimes, even though there is a ban on flavoring, they would just name it something other than a flavor. So in other words, those vapes are still out there, but there was some banning on flavoring.
You had brought up earlier, Aleshia, the idea of if it's less expensive, you tend to see a greater usage. It kind of similar reminds me of how, you know, cigarettes are taxed at a very high rate as to be sort of a, some would argue, a moral regulation or something like that. Do you see movement around that for vaping? Is that something that you think will fall? Not fall, but start to be taxed at a higher rate so that it won't be 99 cents, or is that just not in the same realm?
Well, this is the thing. Even when it comes to cigarettes, even when it comes to the taxes, and we all go to convenience stores because we all have to get gas. Unless there is a severe tax, it does not make a difference. And I actually have a tax presentation I'm going to compile, and I will send it to you to share as well, Dave. But the whole point behind it is, if they raise taxes 50 cents, $1, $1.50, when you go to the gas station next time, pay attention. What do you see? You see deals, you see promotions, you see special. So if we raise taxes by 50 cents, they'll offer a 50-cent coupon. If we raise taxes by $1, they'll do it 2 for 1. The best way I can say it is that big tobaccos, and that's what we call them when we lump them all together, they have more time and money than I don't know we will ever have to truly combat this. All we can do is keep trying, because if we think we're one step, we put 1 foot forward, they put 10 feet forward. I don't know if you know this, but they spend about $1 million a day in just advertisement for tobacco and vape products. $1 million a day.
That's in Mississippi alone.
So with that being said, what are we to do? You know, this year's a leap year, so that was $366 million. So like I said, every time, and not only that, you know as well as I do, especially if you have teenagers or young youth around you, they are big into influencers. If the influencers are doing it, it must be written in stone. So then they hire these influencers that become vaping influencers that teaches them all these smoking tricks and all these different things. So there's always some tactic they're using to stay 10 steps ahead of us. I didn't even know, but someone told me even locally, they have what they call like these smoking competitions where they can do all these different tricks with smoke and you win money and prizes and probably free vapes as well. Then you have the other aspect of it where now you're putting anything you want into a vape, the refillable one. Now you have marijuana. You have whatever you want to concoct. Now you're mixing stuff. Or you're a chemist, and that's where the problem lies. Also, too, those vapes are combustible because of the lithium batteries. There's all kind of issues when it comes to vaping. And so I feel like sometimes when we tackle one thing, then here comes another problem. So to answer your question about the tax, it would have to be an astronomical amount. It can't be something as simple as 50 cents, $1, because the marketing, what they're going to do is they're going to give coupons and promotions. That's why they went from $50 to now you have the disposable ones for 99 cents.
But also too, in the past, research has shown that when it's higher, you know, the taxes do make some difference, and it affects a lot of times the adults more than it does the youth. But one thing that we're trying to do here in Mississippi is that, you know, there's a tobacco tax, but you know, vaping is not considered a tobacco product. It is a nicotine device. So we gotta get vaping to be considered a tobacco product so it can fall under that realm of taxes. And so that's one thing that they're working on, that we're working on as well.
Feel free, everybody. We've got a few more minutes if you have questions to ask. I do have one more, which is, you know, sometimes it's when you're in it, it's easy to lose perspective. Would you say that in 2020 we are better off now in terms of smoking nicotine health than we have ever been? It's just that it's still a severe issue, or is it worse than it's ever been? Is it, can you kind of give some perspective of where 2020 sort of stands in comparison to where we have been in the past, and certainly in past decades?
Personally, Dave, I feel that may be a county / city / region, you know what I'm saying, the last state thing. And the reason I say that is if you're in an area where you know COVID is just astronomical, people may be more mindful about their smoking. But then again, we're also in a situation where people are more closed off, stress levels are higher. So I feel like it's a double-edged sword, to be honest with you. And it may just depend on what region you're in, what state you're in, what county you're in. Everybody knows nicotine is one of the hardest addictions to break. It's even harder to break than being on illicit drugs. So with that being said, and then you add on the stress and the anxiety of COVID and everything else. So it may just vary by county, by region, by state. And also too, you have to realize too, a lot of people are staying indoors. So are they not smoking, or they just now they're in their home, so you just don't see it as much? Because I personally, I don't see smoking as much. I walk in the area and I could tell if it's cold, you can really tell when someone has been smoking because it lingers in the air longer. So, but I don't smell it as much. I don't see it as much. I know it's still happening, but I feel like we're so spaced out now that may be why I'm not seeing it as much and smelling it as much. And that's just my personal take on it.
And I think right now, Dave, for the most part, it is a personal take. And actually, I had this question asked to me in an interview just on last week. And so I reached out to our national office to see if there was any data out there on that particular issue. And right now, it's not. However, we probably will see some research on that in 2021, some results, some information on that in 2021. They are out there, like I said, researching that, but we don't have any compiled data as of yet.
Thank you. Okay, it's 9:50. I would love to, first off, start by thanking Rochelle and Aleshia. This is incredibly important and valuable. And whether it's, directly applicable to nonprofits right this moment, or just making sure they're working and supporting their communities and knowing about issues that are going on, we thank you for this information. It is extremely valuable, and the work that you do. I would love to open the floor up to community announcements right now. We're going into Thanksgiving, so let's talk about what are some things we're thankful for, what are some things that, despite the horrors of 2020, that have gone well for your organization, or things that have improved, or all that kind of stuff. Let's maybe try and talk about some positive news in the last few minutes we've got together.
Dave, before they begin, I do want to say I put my link in the chat on next Tuesday. I think it is Tuesday or Wednesday. I know it's 17th. I will be having my quarterly coalition meeting, and it's open to anyone. And this meeting is going to be specifically for talking about our SWOT, our strengths, weaknesses, opportunities, and threats of the organization. So if anybody wants to just come, chime in, even if it's not your county and you still want to come and just chime in, I greatly appreciate it, because sometimes having a fresh look on things helps. So it's open to anyone. It'll be from 11 to 12. And if you missed the link or need the link, please just email me. I'll be more than happy to send that to you. Thank you.
Wonderful.
And Dave, before I tap off, just want to say that I am a passionate public health advocate. And not only do I believe in physical health, but I believe that our mental health is so important. And I'm glad that you posed this question to the individuals that's on the call today, because actually this month is National Gratitude Month. And I think that is something all of us can think about as we move forward towards the end of 2020. 2020 has been a year that many of us will never forget. And within all of the challenges we have, personally, I still have things that I am grateful for. And you can go out to nationaldaycalendar.com for more information on National Gratitude Month. And again, just thank you for allowing us to be in on the call.
Great. Thank you. Others? Oh, come on now. I know there's good.
I'll share, because I was actually thinking about this earlier this morning. I have been working from home since just after St. Patrick's Day. And I'm super grateful that my board is cooperative in that. I really love being able to do that. And this morning I have this routine. I have this aging dog. And so I take him on his walk first, and then we come home, and then I take my power walk, and then we sit on the porch for a few minutes. And I'm sitting out there this morning, I'm watching everybody, jumping in their cars in the neighborhood, going to their offices, and I'm watching the numbers. And I said to someone about a week ago, I'm still living like it's May. I don't go anywhere. I don't do anything. I don't see anybody but one other person. And I've had times over the summer where that felt kind of weird because people were starting to move and get out and traffic was heavy. And it just always kind of shocks me, but I'm just I just needed to kind of be reminded, and you're helping me do that, I'm super lucky that I can work this way. We've got the Zoom thing going. We've got programming online, virtually. We've got it all happening where everybody can be safe, and that I've got an organization that allows me to put my self-care and the self-care of my staff first as we navigate and figure out different ways to pivot. So it's good to, I had it in my head, but it's good to hear you say it out loud and to make me affirm that in a public space. So good topic. Thanks.
Wonderful, wonderful. Tammy, I have to say, I've said this a couple of times. I don't think I've said it on a weekly webinar, but one of the things that I'm thankful for this year, as bizarre as it is at times, is technology. Because had this pandemic happened 10 or 15 or 20 years ago, I think the impact on our society and on our citizenry and on our workforce and our economy would have been devastating to a degree that is truly catastrophic beyond something that we probably have seen since the Great Depression. So as much as technology frustrates me occasionally on a daily basis, the fact that we can work from home, the fact that we do have computers and can stay connected and see each other and continue to do good work is not something I try to forget about all that often, despite how many times it makes me frustrated. So others, we got 5 minutes. Come on, we can share the love for 5 minutes. Nobody? All right.
Dave, I'll jump in and say, I have been trying to find positives within the times that we're in, particularly the COVID situation, because I think everything that comes along presents those opportunity moments. So, I'm grateful that even in the midst of COVID, and as horrible as that is, it has helped us look at the inequities that exist, and it has helped us look at whether it's the digital divide, whether it's inequity in healthcare, whether it's inequity in economic situations or whatever. In the midst of all of this, we have been able to, I hope, more forthrightly, honestly look at those inequities and say, we're going to do something about these. And so if that opportunity moment is presented by COVID, we will come out of it with something much more positive than we had when we went in. So, we'll see what we do, but I think there's hope.
Sammy, on that note, do you feel like, you've been at this for a couple of years now? I meant that humorously, by the way. Sammy's been at this a lot longer than a couple of years. Do you feel like the broader society is more aware of the role and importance of nonprofits in a way that they haven't maybe seen or realized before? Do you think COVID has, given the fact that our governments can only do so much and so many community organizations have had to really step up, do you think that there's a greater awareness of the role of nonprofits, or do you still think that's a struggle that we need to work on?
That's an interesting question. I hope there is. Because clearly, I have from the beginning of this felt that nonprofits are part of the first responders, because nonprofits are in local communities. They are the places that people turn for help. They are, willing to, put themselves on the line to get stuff done in local communities. So I think in local communities, yes. I mean, I think, folks have understood that nonprofits play an important role and probably are understanding that they stepped up to the plate and are doing an even more important role during the COVID crisis. In general, I don't know. I think that's still to be seen. I know that the field is taking advantage, if you will, of the opportunity moment to try to raise the profile of nonprofits. And as you know, independent sector in particular is lifting up with the new administration, with President-elect, and a new team that's coming in there. There's already been a paper requested by the Biden transition team about how the role of nonprofits and philanthropy can be lifted up. And so that has now been presented to that transition team. What happens with that is still to be seen, but I think there is at least an awareness, and the fact that that paper was even asked for as an awareness of the transition team tells us that there is of the role that nonprofits play in all of this. So it's a wait and see. Let's see what happens with that, and if there's some action that's taken at the federal level to create some sort of structural presence for nonprofits, then it will be an amazing thing that has happened, and that's on the table now where it wasn't on the table before. So we'll see.
Fingers crossed. You all, thank you for taking the time to be here this week. We appreciate you coming out every week and engaging with us. It is truly a highlight of my weeks. So thank you. Please be safe, be well, wear your masks, don't smoke or vape.
Wash your mask.
And wash your mask. And we will see you next week. Take care, everybody.
Thanks, Dave. And I just want to say thank you too for the moment of silence that you do. It means so much more to me now because unfortunately I have a friend, her mom got COVID and then got pneumonia and passed away just last week. So when it hits you like that, everything is magnified. So I just thank you for even doing that, taking the time to do that on every call. Thank you so much. And just want to say happy Thanksgiving, everybody, and enjoy your families. Make memories, even if it's in a bubble.
Amen, and thank you. Perfectly said. Have a great one, everybody.
Bye.